an associate professor of medicine at Columbia University Medical Center here in New York, CLL, clinical trial specialist, leukemia specialist, who obviously has a very near and dear heart interest in CLL patients. The impact of CLL on someone's immune system is varied. There's no doubt when we think about CLL, remember CLL is a disorder of one's lymphocytes. And the lymphocytes help to fight off pathogens that include bacterial infections, viral infections, fungal infections. And so there's no doubt that since these lymphocytes are impaired due to the underlying disease, there is variable impairment in one's immune system. So COVID and CLL and one's immunity is important because we are concerned that our patients are more susceptible to complications to COVID due to their abnormal or imperfect immune system. And oftentimes getting one's family and friends on board to understand that can be difficult during this time. It's important for a CLL patient to talk to their physician and team to help them navigate through COVID as it evolves, because there are important things and treatments that are available to patients who develop a COVID infection. There are monoclonal antibodies, there are oral antiretroviral therapies, and this will continue to evolve going forward with the variants as our treatments improve over time. We know that COVID has evolved and certainly continues to be present with us, and we're going to be living with this on sort of a daily basis. And so there's no doubt that it has impacted our CLL patients' lives and how they conduct themselves with family and friends. And sometimes it's hard to have everyone get on board with how to protect their loved ones, whether they're the loved ones with CLL, or how to socialize as a group if a patient with CLL is part of that group environment. I think going forward, there's an important notion that we still recognize that our CLL patients should be wearing masks, maintaining their vaccination status with boosters. Obviously, hopefully there'll be newer vaccines that are coming available soon, but certainly I think you need to you have to feel comfortable doing what is okay with yourself. And so some people are taking a much more conservative approach. There are other people who are getting out more and about and socializing with family and friends. And I think it's a reasonable thing, but you need to take precautions that you feel comfortable doing. But I think we're always going to have a level of heightened concern with our CLL patients whose immunity is impaired and different, and your circumstances might be different depending upon where you are on your CLL journey with treatment or not treatment, and that can impact things as well. So I think it's important for you to talk to your physician and team to help you navigate as COVID evolves and what therapies and practices might evolve along with that.